Hi there, I'm Robin Childers. I'm the Executive Director for the Home Health Section of the American Physical Therapy Association. I want to thank you for joining me today with this quick introduction to the Advanced Competency in Home Health program. This program is currently a certificate program for physical therapists. We do expect to launch a PTA companion program to the Advanced Competency in Home Health program sometime in late 2018. So look for that. In the meantime, this certificate program is just available to licensed physical therapists. In this presentation today, I'm going to give you just a brief overview of why this program was created. I'm going to cover what the program requirements are and how to participate in the program. So first thing is, why did we develop this program? And basically it is because we recognize that the home health setting is a very unique setting. It is unique from a regulatory and payment standpoint. It is also unique from a clinical point of view in that physical therapy practice in the home health setting is particularly unique because physical therapists are on their own in patients' homes providing treatment, interventions, evaluation, etc. So this is a unique environment. A great many students, new therapists don't have exposure to the home health setting. Orientation to this setting as a consequence is kind of a mixed bag. Some agencies have very good orientation programs for physical therapists who are new to the home health setting. Others do not invest as much time in orientation. So we really established this program to address the unique qualities of this practice setting and to help better prepare physical therapists, especially those who are new to the home health practice setting, for practice in this setting. Folks who have been practicing in the home health setting for years and years will also benefit from this program. As I mentioned previously, orientation to this setting is often hit or miss. So for physical therapists who've been practicing in this setting for some time, they may find that this program greatly fills some of the gaps. It will also help to bring you up to speed on current evidence-based practice for this practice setting. Program goals are relatively straightforward. We really want to raise level of practice in the home health setting, and this program is partly designed to do that by assuring some minimum standards for practice in the home health setting. But it's also intended to recognize PTs who successfully complete the program and meet those standards. And they're essentially the standards established in a really rigorous program where clinicians will be provided with opportunity through the face-to-face course that supports this program to demonstrate skill. One of the most common questions we get about this program is, when I finish it, will I get a credential or initials I can put after my name that indicate that I've completed this program or that I'm certified in this particular area? And the answer to that question is simply no. Once you complete this program, you can say that you have a certificate in advanced competency in home health, but it doesn't include a credential. And the reason for that is that there is a movement within the physical therapy profession, but also within a great many other healthcare professions, away from credentials. And the simple reason for this is that the people to whom those credentials should mean the most, your patients, because a credential presumably tells your patients about the kind of expertise that you have, those credentials by and large do not mean anything to patients, the people that you're actually treating. And I tried to illustrate this with the example at the top of this slide of various credentials that we see commonly in the physical therapy arena, although some of these credentials don't necessarily pertain directly to physical therapy practice. But this kind of gives you an idea of the smorgasbord, you know, that you might have behind your name with all these various credentials, and how not only does it not mean anything often to the patients that you're seeing, it often doesn't have meaning to among your peers, fellow physical therapists, likewise to other healthcare professionals. So while we feel very strongly that that the work you go through to get those credentials is really important and it's really meaningful, we think that the credentials need to be spelled out and that the emphasis needs to be really describing and explaining the meaning of that expertise to both patients, but also to your peers and to other professionals. The other reason that we are staying away from the credential is because the American Physical Therapy Association 2016 House of Delegates actually adopted a motion that emphasizes the movement away these credentials, and that we need to use more meaningful language to describe and explain our expertise to the public, to patients, to peers, and to other professionals. So that's why this program doesn't have a credential. Program requirements. Okay, this is the nuts and this is what you're here for. Here are the nuts and bolts of what you have to do in order to get that certificate in advanced competency. These are the requirements for the program. And although these are listed in an order, the order, with one exception, the order that you complete these requirements doesn't matter a whole lot. So there are 5 core online modules. You can actually register for them in a bundle through APTA's Learning Center. And if you buy the bundle for those 5 online courses, you'll save yourself quite a bit of money. You do not have to do it that way. You can register for them and complete those courses one at a time. But I want to make you aware that that discount is available if you want to save some money. So there are 5 core online modules available through APTA's Learning Center. 4 of those courses are prerequisites for the face-to-face course. So you have to complete those prerequisites before you can attend or participate in the face-to-face course. And those are the first 4 courses listed in the 5 core courses. It's the clinical assessment, medications and pharmacology, regulation and documentation, balance and falls. Those are the prerequisites. And then ethical considerations is another online course that you have to take, but you don't have to complete that one before you can take the face-to-face course. So there's about 20 hours total in those online modules. Then we have the face-to-face course, which is around 15 to 16 hours, and that is really focused on skill demonstration. Additional requirement is 4 hours of minimum online elective courses. These are also available through the APTA Learning Center, and you are not required to complete these after you've completed everything else. You could start on these elective courses right now if you wanted to. So again, no specific order on those, but you're required to do 4 hours minimum. Now, the elective courses come in a variety of lengths. There are 2-hour courses, 3-hour courses, 6-hour courses, and I think there's even a 7-hour course. So for example, if you take a 6-hour advanced competency elective course, you will meet the 4-hour minimum requirement for electives if you complete and pass that course. If you take only a 2-hour elective course, you're going to have to complete more electives in order to meet that minimum 4-hour minimum requirement. So you can do more, but you can't do less, basically. And the electives focus on a variety of specialty areas within the home health setting practice. And there's also some shorter electives that really are more focused on some areas of clinical assessment, vital signs assessment. So they're kind of more detailed versions of some information that may be included in some of the other courses, but those also qualify as electives. And the only other requirement in here is that you have to do all the program requirements, successfully complete those within a 24-month period. And there are a couple of reasons for that. The primary one, that we set a deadline of doing it all in 24 months, is to make sure that you are getting current information. We realize that some of this information, especially the regulation component of this program, that information is going to need to be updated more regularly. So we want to make sure that when you complete this program, you have had relatively current information. And of course, some of the evidence used in some of these courses likewise will also be updated over time. The other reason that we give you 24 months as opposed to, say, a year is we only offer the face-to-face courses 2 to 3 times a year. We expect that to grow over time as demand for this program increases, but because it's only offered a limited number of times every year, we give you 2 years to complete it, with the idea that that's a reasonable expectation for you to get to one of these face-to-face courses. So there are the program requirements. Pretty straightforward. Okay, what does the program cost? Home health section members, it's about $994 a year currently. If you're an APTA member who is not a home health section member, it's $1,200. There is no reason for anybody to fall into that category when it's only $45 a year to join the home health section. So if you're an APTA member who is not a home health section member, I highly recommend that you join the home health section in order to get better pricing on these courses, because you've got a difference of a couple $100 between the home health section member price and the APTA member price. You know, if you spend that extra $45 or less, if it's prorated, you know, say you're in the middle of your membership year, it just makes perfect sense to join the home health section. Not only are you going to get that terrific discount in pricing, but you're also going to get additional information and resources as a member of the home health section. So my tip to you is join the section first if you aren't already a member. For non-APTA members, the price is $1,690 thereabouts for this program, and again makes a great argument for becoming a member, so that not only do you get the discount on the courses for this program, but you're also going to get a wealth of information and resources by being a member of your professional association. So how do you sign up? It's pretty easy. As I mentioned early on, this program is really collaboration between the home health section and the APTA Learning Center. We are entirely separate entities, so because of that, registration for the components that are part of this program are a la carte. So you need to register for the core courses, you'll need to register for electives, and you'll need to register separately for one of the face-to-face courses. So all of the online courses are available through the APTA Learning Center. The face-to-face course is offered a couple of different ways. When it's offered through APTA's Combined Sections meeting, then you register through APTA. When it is offered as a standalone course, by the Home Health section, you'll register through the Home Health section's website. We have a calendar of events on our website, in addition to a wealth of information on the Advanced Competency in Home Health page, and we provide you with links to the various courses as they become available, and we regularly update that information. So once you're enrolled, say for example in the core courses, I start tracking your progress. You register for the courses, I'll watch for you to complete the various program requirements, and I'll send you occasional email messages that tell you where your standing is so that you know what you have left to do. It is also helpful if you keep an eye on that for yourself as well and make sure that you get registered for all of the course requirements. Pretty straightforward. Next thing is, in terms of recognition, when you complete the program, we provide you with a certificate of achievement that looks like the one photoed on this slide. We also do a lapel pin. These pins only go to graduates of this program. So if you see somebody wearing one of these pins, you know that they have successfully completed this program. We also have some other kinds of recognition, such as a list of graduates on our website. So you can check in at any time to see who are some of the qualified therapists who've gone through this program. The other thing that's important to know is the certificate has a renewal period that's 5 years from when you complete the program. So it does require some additional steps in order to renew that certificate, and we'll keep you in the loop about what's needed in order to do that. You'll get a notification about when the renewal is due, and we'll nudge you about taking the necessary steps to renew that certificate. Where to get more information? Very best place to start is on the Home Health section website. And there is an Advanced Competency page dedicated to the ins and outs of this program. Just select it from the Education drop-down menu on our website. And as always, I'm at your service if you have questions, comments about this program, concerns. Give us a call or shoot me an email message. Greatly look forward to your participation in this program and wish you good luck.